Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Right. Carcinoma esophagus, clinical features of carcinoma esophagus. So, in the clinical features of carcinoma esophagus, okay, a patient with carcinoma esophagus mainly presents with, we have to divide it as early stage cancers or advanced stage cancers. If the cancers are in early stage, then the patient is most of the cases he is asymptomatic, or sometimes the symptoms may mimic that of gastroesophageal reflux disease. If you were asked what is the most common symptom of carcinoma esophagus, the most common symptom of carcinoma esophagus is dysphagia followed by weight loss. Right. If the patient presents with dysphagia and weight loss, then it indicates that the patient is in advanced disease. Either dysphagia or weight loss, then this will indicate that the patient is in advanced disease, because in earlier uh, stage cancers are mainly asymptomatic. Then other symptoms can also develop, especially in advanced cases when the patient develops tracheoesophageal fistula. Then the patient might develop aspiration of fluids along with choking, and coughing may be seen in the patients. Whenever there is involvement of recurrent laryngeal nerve invasion, so whenever there is direct invasion into the recurrent laryngeal nerve, in such cases the patient might develop hoarseness of voice and vocal paralysis are present in the patients. Now if you were asked what is the most common site of metastasis, overall in the carcinoma esophagus the most common site of metastasis is liver, followed by lung, and followed by bone. Even paraneoplastic manifestations can occur with esophagus. So, if paraneoplastic manifestations are mainly associated with adenocarcinoma of esophagus. So, the paraneoplastic manifestations associated with adenocarcinoma of esophagus is actually a motor neuropathy is associated with adenocarcinoma of esophagus.
thank you and thank you for watching.